Hi everyone, thanks for coming to this discussion about our paper, Engaging Youth in Mental Health Research, a Systematic Review. My name is Erin McCabe. I'm a Health System Impact Fellow working with Dr. Maria Santana and Dr. Jen Zwicker. And I'm co-funded by CIHR, Alberta Health Services, Provincial Addictions and Mental Health, and MyTax. Sarah Rabi and Maria Santana are co-authors on this project, and they'll be leading the discussion and Q&A following this presentation. So just to explain a bit about why we undertook this project is because our team is working on a large child and adolescent mental health patient-oriented research project where patient engagement is foundational to this research. So we undertook this review to help inform our own approach to patient engagement. So although patient engagement for adult populations is becoming more and more accepted, youth engagements is still lagging behind. And that might be because it could be considered a little more challenging. There are system level issues like sometimes research ethics boards, issues of consent in youth, and a lack of institutional support. And then there's practical issues like researchers not feeling competent about working with youth. There's difficulties reaching youth for recruitment, and also a lack of funding for youth engagement activities. So engaging youth in mental health research might be even more challenging than just health research, and that's because there's a perception that youth with lived experience of mental health concerns might be reluctant to be involved in research because of past issues like, for example, experiencing stigma in their community or within healthcare settings that could create issues of trust between youth and health researchers. It also might require disclosing mental health concerns or their mental health concerns being revealed to their peers. So that might make youth less willing to engage in research. And then from the researcher side, researchers might be reluctant to involve youth with mental health concerns because they're seen as vulnerable and that engagement activities could put their well-being at risk. However, youth engagement in mental health research is vital. Youth mental health intervention services and policies are undergoing redesign to respond to increasing demand for services. So youth engagement contributes to creating services that are relevant and accessible for youth. It also recognizes the youth's right for agency and power in shaping the mental health services that are for them. So the purpose of this review was to learn more about youth engagement in mental health research. So how it's being done currently, the impacts that it has had, the successes and challenges encountered by researchers who are doing engagement, and also to provide recommendations to researchers based on learnings from previous research that are discussed by those authors who are doing engagement research. And as I said, this review informed our own approach to youth engagement in our mental health research project. But we also wanted to inspire other mental health researchers to engage youth, potentially enhance practices of youth engagement, and also provide evidence for funders that youth engagement is worth supporting. So this was a systematic review. We used what's called a meta-aggregative approach to qualitative synthesis. So that's a way of putting together qualitative or written information rather than numbers, which is typical in a systematic review. We searched in 3 databases for articles where youth were between 10 and 25 years old, in any type of research, so mental health services research, clinical research, community-based participatory research, public health research, health promotion, in any setting, so like hospital or residential treatment, communities, community services, outpatients, and schools, school services. And the studies had to describe at least one research activity of the youth researchers and also one impact of youth engagement. So if an article said they did youth engagement but didn't provide any details, then we didn't include it in the review because it didn't really give us any valuable information. We did only include articles from publicly funded healthcare systems, so similar to Canada. That basically meant that some articles from the US were excluded. And in the end, we found 16 articles which described 14 different studies. So there were 2 cases where 2 articles were written about 1 study. So a quick description of the articles. It was clear that youth engagement is becoming more mainstream. As you see, the earliest article was 2014, and then there's a big increase from 2020 to 2021. We did the search in March of 2022, so this number is probably likely higher for 2022. The articles we found were 6 were from Canada, 8 were from the UK, the United Kingdom, 1 from Norway, and 1 from Australia. The ages of the youth were between 9 and 25, but mostly they were older than 16. Most studies engaged youth with lived experience of mental health conditions, so 12 out of 14. And then diversity and inclusion within the research team was mentioned as a goal in 5 studies. In terms of how youth were engaged, there were 5 studies where like a youth research advisory council type of model was used. And then 3 studies where youth were on, like one or more youth were on the research team as partners. And then 6 studies did a combination of that. So they had their youth partners, and then they also had these research advisory teams where they would bring bigger decisions to those bigger teams. So usually in a systematic review, there's a quality appraisal part, and that's where you look at how well the research was done using a standardized tool. So your rating usually end up with a number that indicates how high quality the research study was done. But in our case, we're less concerned about the quality of the research methods and more we wanted to know about youth engagement. But to my knowledge, there's no real tools to use to assess the quality of youth engagement in research directly from a research report. So instead of rating the quality of youth engagement, we just looked at describing how youth were involved. And we did that in 2 ways. So we used the Innovate research types of youth participation in research, and then also the CIHR research life cycle. So quickly here, the Innovate research types of research. There's 4 different types. The first is participation, and that's just your traditional, like, youth are participants in the study. So they're filling out surveys, or they're being studied, I guess you would say. And then the consultation type of research is youth providing feedback on research decisions, but they're not really involved in doing specific research activities. The next type is a partnership, and that's where youth are working collaboratively with researchers as equals on the research team. And then the last type is youth-led, where every stage of the research is driven by youth. So in this, in our review, we found that half of the studies used a partnership model of engagement, where youth are equal partners and actively involved in collaborating and leading different research activities. 6 studies fell into the consultation type of engagement, and then only 1 study was entirely youth-led. So the second way that we described youth involvement in the research process was using CIHR's key stages in the research life cycle. So what we did was go through each article and record where in the research life cycle that youth were involved. So you can see that 14 studies, so all the studies involved engaged youth in evaluation and quality assurance of the study, which includes activities like reviewing the data collection instruments, making sure recruitment strategies are relevant, basically anything to do with monitoring the quality of the study. And there was also a lot of studies where youth were involved in knowledge translation, data analysis, and interpretation. So now for the results of the review. First, the impacts of youth engagement, which we divided into 3 categories: impacts on the research process or outcomes themselves, personal impacts on the youth researchers, and personal impacts on the adult researchers. This figure was created by one of our youth research partners to represent the impact findings. He included the 2-way arrows to represent the interdependencies between the 3 types of impacts. So the effects that youth researchers have on adult researchers impact on youth researchers impact the research process, but the research process also impacts youth researchers. So the most common research process impacts of youth engagement reported by authors were data collection. That was done either by shaping the data collection instrument or being actively involved in data collection. The findings of the study were also often reported as impacted by youth involvement in the analysis of the data. And enhanced knowledge dissemination was also mentioned commonly, and that was done either by youth co-presenting or advising on knowledge translation strategies. And then one unique impact to seems like mental health research was that 2 studies that youth researchers that youth researchers enhanced the comfort and safety of the participants in that project. So in terms of the personal impacts of youth engagement, adult researchers reported increasing their knowledge of youth engagement strategies. They stated that youth engagement broadened their networks and enhanced their understanding of their research findings. They also felt a sense of pride in youth researchers' development over the course of the projects. And in one study, authors reported a greater sense of accountability for their research, which translated into more motivation to perform high-quality research. On the part of youth researchers, they reported positive experiences as well, such as feeling empowered and respected, particularly when witnessing their input being acted upon, and they felt more confident in their abilities. They reported that they gained knowledge about research and mental health, and also developed research, project management, and communication skills. They gained a sense of social connectedness and expanded networks as from being part of the research team, and they also felt that the research experience was a benefit for their job resumes and applications, as well as generating some income for them. Most impacts were considered positive. However, 3 negative impacts were reported. The first was that youth being involved in data collection and analysis may introduce a bias into research findings by unintentionally influencing participant data collection or inserting their own experiences into the analysis. Personally, I think this is a bit debatable as to whether this is unique to youth or patient partners doing the research. I would argue that all researchers bring their own background into the process. And so maybe this could be a point for discussion later on. The other 2 things, negative things that were reported were that youth engagement may decrease efficiency in decision making, and this came up when there were efforts to make sure all voices were heard in decision making And the third was that engagement requires more funding and resources to do well, and that won't be a surprise to most people in this room. So in terms of challenges to youth engagement that were reported in the studies, one thing was that it requires more time and resources to build relationships. It was a challenge sometimes to recruit and retain youth researchers. Over time, if youth researchers were participating in a longer research study or multiple studies over time with a team, there was a tendency that towards them becoming more aligned, I guess, with the adult researchers' perspective over time and maybe losing the youth voice. And then the last thing was navigating challenges related to diverse perspectives and priorities of the research team. So I mentioned that in the last slide, but also adults. So the adult researchers prioritizing rigor and youth prioritizing patient comfort would require some navigating or decision making about differences in youth and caregiver perspectives in terms of how research should be done. And then also just the perspectives of youth from different backgrounds were sometimes, of course, not aligned. So just having to navigate those situations was viewed as a challenge. Some facilitators to youth engagement. The first was creating a safe and inclusive space for youth to share their perspectives. The second thing that facilitated youth engagement was that when adult researchers were self-aware of power dynamics and how they are relating with youth. A third thing that facilitated engagement was making efforts to build genuine and trusting relationships between youth and adults. And then just practically speaking, having a dedicated youth engagement coordinator on the team, providing refreshments for meetings, and also compensation for youth were viewed as facilitators. So then we also collected all the different recommendations that the authors made in their different articles and put them all together. So the first area was for training. And so training should include education about the research topic, how research is done. Youth researchers should be given the opportunity to practice their skills prior to the project starting. They should be given training on communication and leadership skills. Training and support should be more intense early in the project with a gradual reduction of support as youth's competency increased. When transitioning youth into a project already in progress, be mindful that they are adequately prepared and have the same opportunity for training as youth who began at the start of the project. There's a suggestion that experienced youth researchers can lead the youth research training. And then on the part of academic researchers, they should be given knowledge of youth engagement, for example, including patient engagement as part of research masters and PhD curriculums, and providing additional training for established researchers. Two things that were mentioned by our youth who consulted on this project, and this has to do with training, is that the adult researchers should have training in trauma-informed approaches and also cultural competency training, which would help them build better relationships, I guess you would say, with the youth. Another recommendation was to be aware of the composition of your youth researchers on your team. So consider recruiting several youth at the outset of the project due to difficulties sustaining youth and involvement over time, and ensuring diversity and youth representation when appropriate for the project. And then also including diversity in the level of research experience. So also make efforts to include youth who are naive to research. There were some recommendations for the processes of engagement. So first, engage youth early in the research project process to optimize their impact. Have a dedicated engagement facilitator or share engagement coordination responsibilities with the youth on the team. Be strategic about youth engagement activities. Plan ahead for engagement during key transitions in the research project when decisions will be made. Have a flexible budget with contingency funds for unexpected research activities suggested by the youth researchers. And build in a mechanism for asking for feedback from youth about the engagement process and how you will incorporate feedback into to your engagement. In terms of approaches to meetings, so mostly consultation meetings, provide opportunities for both written and verbal participation in the research project process. So it depends. Different youth will have preferences for different forms of participation, so you should offer both. Use age-appropriate and engaging activities during consultation meetings. Consider having youth co-facilitate your meetings. When seeking feedback, use case scenarios and examples to make abstract concepts more concrete. Use warm-up activities before meetings. Provide small group debriefs, so pre-briefs and debriefs for youth prior and after meetings, just with you so that you can explain meeting objectives, key terms, and give them an opportunity to ask questions. And then also a debrief after meetings gives them the chance to provide feedback that they were maybe reluctant to share with a larger group of research team members. And then just make sure you provide refreshments during the meeting. Other recommendations were around incentives. So include incentives like course credits and certificates of completion where possible, and provide compensation for youth's time and travel for meetings and research activities. The last three areas are more about how, almost like the relationships part of youth engagement. So agree on expectations ahead of time. So having a conversation about it, be clear with youth about the objectives of the project and its expected impact. Establish clear role expectations in collaboration with youth, including the responsibilities of both youth and adult researchers. And then also be really clear about the degree of control that youth will have over the project. So some of the relational elements that you should be aware of to reduce the power differential between youth and adults, establish a collaborative relationship early on built on a foundation of trust, respect, and rapport. Create a safe space for open discussion. So for example, include social identity in introductions, and adult researchers should be transparent and genuine in their discussions with youth. Dedicate time and funding for relationship building, and demonstrate respect for youth and their impact on the project by following through on their decisions and recommendations and also sharing the final results with them. The last area of recommendations were the engagement conditions. So this included considering ways of minimizing the potential for distress in youth. So for example, you can hold your meetings at community agencies they're familiar with, or provide peer or professional support after the meetings, and seek feedback from youth about the experience of these meetings. Include caregivers, but use separate forums to encourage youth's voice and unique opinions. Use youth-friendly meeting spaces and communication tools. For example, group messaging apps might be more appealing to youth rather than email. So you can determine that in collaboration with the youth. have flexibility with meeting times and venues to accommodate youth schedules. Also be flexible about the degree of involvement of youth. So matching what the youth wants to contribute with your expectations. Be aware of and accommodate physical, mental, and emotional needs of youth researchers. And finally, make efforts to share power and leadership responsibilities with youth. So the youth engagement in this review, we had a consultation meeting with 3 youth who were between 19 and 24, all identifying as cis men, all Canadian citizens, one with Chinese and one with Southeast Asian heritage, all with previous experience engaging in mental health research. We asked questions about the findings, so whether the findings align with their experiences engaging in youth research, and also if they had any additional recommendations to add. Overall, youth agreed with the findings of this review. They really emphasized that overcoming the power differential between youth and researchers is important, and also that it's really important to make an effort to represent diverse youth voices on the research team. With our input, we added 1 new impact, 2 new challenges, and reorganized some of the recommendations section, and also added some concrete examples to some of the recommendations. 1 youth became more involved after the consultation meeting and produced that visual of the impacts that I showed a couple slides back, and also contributed to the writing of the manuscript, and he is included as a co-author on this paper. So key takeaways from this review were that youth are willing and capable of being involved in mental health research activities across the research cycle. Youth engagement has many positive impacts on mental health research. And in these articles, youth did not report any negative personal impacts of their involvement in research. And this suggests that concerns about youth with mental health conditions being vulnerable may not be a good reason to avoid youth engagement in mental health research. One big caveat to this last statement, though, is that researchers whose articles are included in this review are the ones who are making efforts to engage youth already, taking time to evaluate that engagement, and also writing about it. So they're likely researchers who are quite conscientious of doing youth engagement well, and there likely exists examples of where youth engagement went poorly for the youth, but these might not be written about, so we didn't capture them in this review. Another thing is that there's an unavoidable power dynamic in place when adult researchers are leading evaluations of youth engagement. So even in these studies, there might be examples where youth were reluctant to share their negative experiences for the purpose of the reporting in the research article. And then I just want to acknowledge one other limitation here, and that is the lower level of involvement of youth in this review. So I'll just explain that by saying that as the lead author, I did not have any experience yet with patient engagement. So this review was really about me learning about it before diving completely in. So that's why we had youth come in later on after the articles were selected and the most of the results were completed, so they just consulted on the results. So we have, here's my references. So here's a couple of potential questions for the discussion, which I'm sorry I'll be missing. The first is that there is an undeniable power dynamic in place when adult researchers lead evaluations of youth engagement. So how could this be overcome? That would be an interesting discussion to have with all the expertise in the room. And The second question I had was, would it be possible to create a critical appraisal tool to rate the quality of youth or patient engagement as reported in an article, in a research article? So is this even a possibility? Is there a set of criteria you could apply to a research article that would tell you whether youth or patient engagement was done well or not, that you could use across different research studies? So thanks for listening, and I hope you have a great discussion.